Welcome everyone to Women in Epilepsy. We're very honored to have Dr. Vimala Vajjala come and talk to us about this very important topic. Dr. Vimala Vajjala is the director of the Video EEG Epilepsy Monitoring Unit and Concussion and TBI Center at the Comprehensive Epilepsy Center at Hawaii Pacific Neuroscience. She is a sub-investigator at both the Epilepsy Research Unit and Headache Research Unit. She is also a clinical assistant professor of medicine specializing in neurology. Dr. Vajjala attended medical school at Kakatiya Medical College in Telangana, India.
That's right.
Awesome. Completing her residency in neurology at Robert Wood Johnson Medical School in New Jersey. She did her fellowship training in epilepsy and EEG monitoring at the Barrow Neurological Institute in Phoenix, Arizona, with additional training in headache medicine at the University of Arizona at Tucson. Dr. Vimala Vajjala is the only neurologist in Hawaii to have completed dual fellowships in headache medicine as well as epilepsy, making her an expert not only in those two separate conditions, but uniquely equipped to handle neurological conditions like concussion and TBI, which is traumatic brain injury, working with an interdisciplinary team, including neurologists, neurorehabilitation, PM, and R team. So with a huge round of mahalo for being here, welcome Dr. Vimala Vajjala, talking about women and epilepsy.
Thank you, Naomi, for such a pleasant and welcome. So epilepsy in women is one of my special interests, and I'm happy and I'm honored to be talking to you, everyone, about that. So happy Veterans Day before I start. So we'll be starting soon. Looks like we have people on, so let's get started. Okay, I do not have any disclosures for today's talk. So let's start with the basics. What is a seizure? Seizure is a term that derived from the Latin language. It means that, okay, there is an abnormal electrical activity, abnormal excessive electrical activity in the brain at one spot or everywhere at the same time, and we have symptoms based on which part of the brain is involved. If you look at the official definition, it says, okay, it's a transient occurrence of signs and symptoms due to abnormal excessive neuronal activity in the brain. And seizures and epilepsy are not the same. They are different. What is epilepsy? Epilepsy, official definition is like if someone has two or more unprovoked seizures. So I want to stress on this, it's unprovoked because there are several things, the triggers that can provoke a seizure. It could be an infection, medications you take, lack of sleep, stress, and all that can make people have seizures. But if someone has two or more unprovoked seizures, more than a day apart, they qualify for the diagnosis of epilepsy. Epilepsy is like a clinical condition, like a disease, and the symptom of having epilepsy is that they have seizures. And if someone has just one seizure, but have an abnormal MRI or have an abnormal EEG, and their chance of having a seizure in the future is greater, like almost more than 60% or more, it qualifies for a definition of epilepsy. So basically, a tendency to have recurrent unprovoked epileptic seizures is called epilepsy. How common is epilepsy? It's more common than we know when we think about it. Currently, there are almost 3.5 million people in the United States with a diagnosis of epilepsy, and year per year, we may have up to 150,000 new cases. If you look around the whole world, there are like 65 million people with epilepsy. The statistics show that at least 1 in 26 people will be diagnosed with epilepsy at some point in their life. And that's pretty significant. What is the difference? Like how epilepsy is different between men and women? There are studies that were done on this, looking into this. And overall, there is no significant difference in epilepsy, the chance of having epilepsy if you compare men and women. So, and then they looked into, okay, if one particular type of epilepsy, if it is more common in men compared to women, so they found out that symptomatic epilepsies, which means it happens of something else, maybe they have a tumor, the brain lesion, the chance of that, having that is more in men compared to women, whereas in women, mostly idiopathic generalized epilepsies, which is the seizures start everywhere at the same time, they are more common compared to men. So basic questions like anyone would have, if we talk about epilepsy in women, there are so many questions. Okay, what are the female hormones I'm going to do? What effect the female hormones will have on my seizures? How the seizures and the seizure medications are going to affect my fertility? Will the seizure medications are going to interact with the contraception, the birth control pills I take, and what does epilepsy do to my pregnancy if I get pregnant? What is pregnancy? How does pregnancy affect the seizures? Am I going to have more seizures when I'm pregnant? And the basic question all of us worry about, what is epilepsy going to do? Epilepsy and seizures and the medications are going to do to the baby. We will try to address all these questions in the next hour. So let's start with the basics. Let's try to understand the menstrual cycle, what happens during the menstrual cycle, and why some few women have seizures around their menstrual cycle. So women of childbearing age group, that may be as early as like 11 years, and as in their 50s too. So the goal of each menstrual cycle every month is to get the female reproductive organs, especially the uterus, ready for the pregnancy. So there are like several hormones working every day to get this. So there are hormones that come from the brain, from the pituitary region, and then those hormones act on the ovaries. And there are hormones which are released from the ovaries and they act on the uterus. The hormones acting on the uterus get the uterus ready with increase in the lining of the uterus and the blood supply of the uterus, getting that part ready for if pregnancy were to occur. If there is no fertilization, no pregnancy, all the uterine lining is shut. That's the bleeding. We consider the part of the first 5 days or so for the bleeding as the starting of the menstrual cycle. And then the hormones released from the pituitary, they act within the next 7 days or so, causing ovulation, which is a release of the egg from the ovaries. And then after that, the uterus gets ready in anticipation of pregnancy. During as I said, there are like so many changes happening during this process. So hormone levels, they fluctuate. This diagram, it shows that, okay, bottom in here, you see all the 28 days. 28 days is normal, but it may be as long as 35 days in some people. The first few days, it's where the bleeding happens. And then as you see, there are certain hormones that go up, FSH and the LH and the estrogen, they go up. And right before like day 14, there's a fall in the level of the hormone. That makes the egg to be released. And in the second part, in the next 14 days, there's a rise in the progesterone, which makes the uterus lining to get thick, rich in blood vessels. And right before the end of the cycle, the progesterone levels and the estrogen level, everything drops. That makes us have bleeding. And this goes on and on and on until we reach menopause. So what do the sex hormones do? So the major sex hormones in women are estrogen and progesterone. The primary function of all the sex hormones is to maintain the reproductive systems, maintain the help women get pregnant, maintain the pregnancy, but they also affect the muscle mass. They affect the bone strength. They also affect our emotions and how our behaviors. Hormonal fluctuations, they not only happen during the menstrual period, they change during pregnancy and even throughout the menopause and right before, even up to 5 to 10 years before achieving menopause. So how these hormones can cause seizures? What happens? Like which hormones are the reasons for the seizures? There are two major hormones, estrogen and progesterone. Estrogen, which goes up, it plays a major role in the first 14 days. It can excite the brain. It's makes the brain irritable, and high levels can trigger seizures. Whereas the progesterone, it is inhibitor. It prevents seizures. So some women, they have more seizures right around their periods or with their periods. There's a name for it. It's called catamenial epilepsy. And most commonly, we see 3 different patterns with that. Some women have more seizures right before their bleeding starts or for the first few days of the menstruation. As you can see here, it's a name for it. It's called C1. It's right where the M stands for menstruation. That's where they may have more of the seizures. And some women have it right at the time of ovulation, middle of the cycle, day 14 or so. And it's right in here, day 14, they may have an increase in their seizures. And least common is the third type. Some women have it the second half of the cycle, like starting from day 14 to 28, they have a lot of seizures. Going back, I want to show you why this happens. So we see that if you look at this chart, the hormone levels are fluctuating, right? And right before the menstruation starts, the progesterone is going down. Estrogen is also going down. But if you look at the ratio of it, there is more estrogen compared to the progesterone right here. That can trigger seizures. And at the ovulation, there is more estrogen compared to the progesterone. That can trigger seizures too. So it's more so the ratio between the estrogen and the progesterone that makes people have seizures. So what do you do about it? How do you know if you have seizures right around your periods? The only way is to keep track of it. Keep track of your periods, the day it starts, the dates, bleeding, and all that. And also keep track of your seizures too. If they're happening right around your period, right around the bleeding part, the menstruation part, or the mid-cycle, or the later part, that helps. That helps identify the pattern, because not everyone has the same pattern. There are 3 different patterns. And keeping track and identifying the pattern can help in coming up with a treatment plan. And the treatment can be it can be tailored to the type of seizures you have around the periods. There are some hormonal supplementations that can help, and there's certain medications that can help too. But there is no specific FDA-approved treatment for it. So talk to your doctor, track it, keep track of all your seizures and your periods, talk to your doctor, and they can help you in identifying the pattern and giving you the right medications. So let's briefly look at the treatment options we have for catamenial epilepsy. As I said, there's hormonal and non-hormonal. If you look at the hormonal, it's the depot shot every 3 months. There are studies showing that the depot shots can decrease the chance of having period-related seizures by almost 20% by the first year of the treatment. It's done every 3 months and works very well. It's very easily tolerated and helps a lot with the catamenial epilepsy. Some of the physicians also use progesterone supplementation that helps too. And there are certain medications that seem to work for catamenial type of epilepsy. Acetazolamide is one of those. You don't take it every day. You take it right before, like the first 7-day period or so, right before the bleeding starts, and it seems to work well. If someone takes it every day, it may not work. And other medications like clobazam, clonazepam also seem to help. Just by increasing sort of already the seizure medications that you're on can also help some people. But the way to go is keep track of your seizures and periods, trying to see what time of the cycle are they happening. That can help your doctor to come up with the right treatment option for you. So moving on to contraception in women with epilepsy. This is a chart from the CDC showing all different types of contraceptive methods, family planning methods available. The top most are the most effective. The bottom ones are the least effective. Most effective, the chance of getting pregnant is less than 1 pregnancy in 100 women in a year. And if you look at the least effective, the chance of getting pregnant, unplanned pregnancy, even on using this using these contraceptive measures is up to 18 per year. So if you look at the most effective ones like implants or intrauterine devices, the progesterone implant, they seem to be the most effective, or having a tubal-like tubes tied or vasectomy, or the permanent sterilization methods, but they come with a chance of failure too. And the middle are the injectables, depot shots, pills, patch, ring, diaphragm. The least effective are the condoms, withdrawal, and sponges. So which is the preferred contraceptive technique for women with epilepsy? The preferred option in women with epilepsy is intrauterine device. There are two types available. It's a copper IUD, which is non-hormonal, and the levonorgestrel, the hormonal, which is basically Mirena. They are highly efficacious. As you can see, the chance of having unplanned pregnancy on it is just like 0.2%, like less than 1%. Implant is also like very low, very minor. And they are not affected by any of the seizure medications that one takes. So no interactions, and they work well. So those two reasons make this form of contraception a reasonable, the preferred option for women with epilepsy. Let's look at what happened. How do the seizure medications affect birth control pills, which is the most commonly used type of contraception method? There are certain seizure medications that can affect the birth control pills. And it has to do with the particular property of those seizure medications. It's called enzyme inducing. It's basically those medications induce several of the liver enzymes and metabolizes the breaks down the contraceptive pills, and they don't work because they're broken down, and you pee them out or poop them out. If you're on those certain medications and you're on birth control pills, there's a chance of having unplanned pregnancy, and you may need a backup contraception measure like using a condom or something else in addition to taking birth control pills when someone is on this enzyme inducing seizure medications. So this is a list of the medications that can potentially affect the birth control pills. Carbamazepine, which is Tegretol, clobazam, eslicarbazepine, it's not commonly used. Phenobarbital, dilantin is known to interact with the birth control pills. At high doses, Topamax can also do it. The seizure medications with no known side effects, as you can see, gabapentin does not usually affect. Vimpat, Keppra, valproate, zonisamide, Zonegran, usually they don't affect the birth control pills. A little word of caution if you're taking lamotrigine. Lamotrigine, the brand name is Lamictal. It can affect the hormonal the birth control pills. And also the birth control pills can also affect the level of lamotrigine in your body. So it's both ways. So if someone is on the 3 week when they take the hormone, the combination of estrogen and progesterone, their lamotrigine levels in their body will be low because the progesterone component, because the estrogen induces breaks down the lamotrigine and you poop it out. When you're taking the placebo, the last week, when there is no hormone in the pills that you take, the lamotrigine level in your body goes up. So your seizures may be very fluctuating. So it's important to keep track of your lamotrigine levels if you're on birth control pills. Ideally, switching to a different type of contraception is best if you can do it, like having an IUD or getting depot shots and all that. If that's not possible, measuring the lamotrigine level is good, so that because it tends to fluctuate, and having a backup. And so if you're on lamotrigine and taking birth control pills, having a backup to avoid unplanned pregnancy is also useful. So when we're ready to plan pregnancy, what do you do? How does epilepsy affect fertility? What are my chances of getting pregnant if I have epilepsy? A recent study done in 2016, they looked at 88 women with epilepsy. Overall, they did not see any difference in compared to women without epilepsy in achieving pregnancy. No difference at all. And also the time that one took to get pregnant was not different. And the pregnancy outcome, looking at, okay, how many miscarriages and how many live births were also statistically the same, maybe slightly higher in pregnancy and women with epilepsy, but there was no significant difference. So it is based on the study, we can say that women with epilepsy are just as likely to achieve pregnancy as their peers without epilepsy. Moving on to the next question, how do the seizure medications affect my fertility? Again, depends on the medicine that you take. Certain seizure medication can absolutely affect your chances of getting pregnant. And it's more so common in people who are taking like multiple medications, especially Depakote, valproic acid. It increases the testosterone levels in our body and makes women have a condition called polycystic ovarian disease, where they have infertility, weight gain, hair coming up in the wrong places. So valproic can definitely affect your chances of getting pregnant by causing polycystic ovarian disease. And some women also report to have like having sexual dysfunction, decreased libido and satisfaction, just being on some seizure medications. So if you're planning to get pregnant, always discuss your pregnancy plan with your doctor. This will help you in several ways. It'll help you, the most important thing, it'll help you in better understanding the risks. What risks are you, what's going to happen, what to expect during the pregnancy. And if you have uncontrolled seizures, talking to a doctor and working with your doctor to get your seizures under control is the most important thing that one has to do before planning pregnancy. And during pregnancy, the drug levels do tend to change. So, and changes in the drug level can make people have seizures. So we have to monitor your blood drug levels. And also working with your doctor, trying to get you on low risk seizure medication at the lowest possible dose will always help. Then we will look into that, like why I say that. What about folic acid? Do I have to take folic acid? So let's start with what does folic acid do? Folic acid helps with in making the DNA. DNA is the genetic material. It helps, it's a basis of us. And it also, folic acid also helps in tissue growth and cell growth. So no matter if they have epilepsy or one has epilepsy or they don't, all women of childbearing age group must take at least 0.4 milligrams of folic acid per day. Almost half of the pregnancies are surprises. And women with epilepsy are at a slightly higher risk for having child with birth defects. And the birth defects, the major ones, they usually happen in the earlier weeks, like 4 to 6 weeks. And most of the women know that they're pregnant. It may take like 6 to 7 weeks even to find out that they're pregnant. And the folic acid supplementation tends to reduces the risk of having certain birth defects, major birth defects, mostly neurological. So women, it's recommended that women with epilepsy in the childbearing age group, that's from like 18 to 45, start taking at least 1 milligram. And if you're actively trying to have kids, increase the dose to 4 milligrams. Talk to your doctor about it, keep your doctor in the loop, and they will make recommendations. Okay, yeah. So things, what are the checklists that you have to do before getting pregnant? Take a multivitamin, extra folic acid. The multivitamin, folic acid in the multivitamin is not enough. You need at least 1 gram. So extra folic acid is very important. For a smoker, quit smoking. Exercise, get some physical activity into daily routine and eat a balanced diet. And the most important thing, don't change your seizure medications yourself. Talk to your doctor, work with your doctor, and come up with a plan to come off the high-risk medications and be on the low-risk medications at the lowest dose, lowest possible dose. So moving on to during pregnancy, what happens to seizures when someone gets pregnant? Most women, they don't see any change, or they may have an improvement in their seizures, but up to 30% of the women may have increased number of seizures. It's more so in the first and the last trimester. There are multiple causes for it. The hormonal changes that happen. They happen during menstrual periods, during pregnancy, menopause. The hormone levels are fluctuating a lot. When someone's pregnant, we tend to retain more water and sodium. That can decrease the drug levels. That's the reason why we have to check the drug levels frequently during pregnancy. Not getting enough sleep. It's hard to find a comfortable position when you're pregnant, and so that you may not get enough sleep. That can stress people out and then make people have seizures. And most important cause is like not taking or just taking low doses than recommended during pregnancy. So what's the best predictor? How I'm going to do during my pregnancy? There's so much research into it. And we know that not having a seizure for 1 year before getting pregnant increases the chance of not having a seizure during the pregnancy. So no seizures for 1 year and you get pregnant, the chance of the pregnancy going very well without any breakthrough seizures is very high. So always talk to doctors about your pregnancy plan, keep them in the loop, get on the right medications, get off the bad medications. You need blood work prior to getting pregnant, and also once you're pregnant, repeatedly, at least once a month. The lab levels, the drug levels before getting pregnant is very important because we need a baseline. We need a baseline to compare to and see how you're doing in the pregnancy. If you don't have a baseline, we are just going blindly. And there are numbers saying that if the drug level goes down by 0.6 comparing to pre and during pregnancy, the chances of having seizure goes up. So what do the seizures do to the fetus? Most women, 90%, they have normal pregnancies and babies, and depends on the type of seizure one has. Focal seizures were like staring episodes, unresponsiveness, all that, tend not to affect the baby quite a lot. It has to do with the generalized tonic-clonic seizures where someone gets stiff, shakes, bite their tongue, pees on themselves. Those grand mal seizures, they tend to affect the baby and the mom. So there is risk of trauma from burns or from falls. There's slightly increased risk of going into labor preterm. There's a risk of baby having low birth weight. We're talking about the seizures, and there's a risk of having a miscarriage from the repeated seizures. It can affect the fetal heart rate because it can affect how much blood is going into the baby, and that can cause decrease in the heart rate. And there are studies saying that kids born to mothers with uncontrolled epilepsy through their pregnancy tend to have lower IQ. Okay, so this is important. The risk of having seizures is greater than not being on anti-epileptic medications. Like the risk of having seizures is way worse than not being on the anti-epileptic medications, seizure medications do work. The risk of or the harm to the baby is very minimal when you stay on the seizure medications. So what happens with the seizure medications on the pregnancy? In general population, the chance of having a major birth defect is almost 2 to 3%. No matter if they have epilepsy or don't have epilepsy, there's a chance that 2 or 3 women in among 100, they may have a baby with some birth defect. In women, the risk is slightly high. Women with epilepsy is slightly high. It's almost double, 4 to 6%. And the risk is even greater when someone is on more than one medication and on higher doses. So the rule of thumb in a woman trying to get pregnant is we try to keep them on one medication if possible at the lowest possible doses, and that can help in cutting down the risk. So what medications have the greatest risk of causing abnormalities in the babies? The Depakote, valproic acid, is known to have the highest risk. It can cause major congenital malformations like neural tube defects, like some problems with the nervous system, the brain, and the spinal cord. It is very well known that Kids born to women who are on Depakote during pregnancy, they may have low IQ and autism down the line. And it is also dose dependent. We see that more often when someone is taking more than 800 milligrams per day. Phenobarbital, it's known to cause some problems in the baby. It's classified as intermediate risk. Sedation can happen, difficulty breathing, and neural tube defects. Topiramate, Topamax, is also intermediate risk. There is an increased risk of having cleft lip and cleft palate in the baby, and that is also dose dependent. We see that more often at 200 milligrams or higher compared to 100 milligrams. Among the medications that are considered as lower risk are lamotrigine and limithol and levetiracetam, which is Keppra. There are lesser chances having birth defects with these medicines. And this is again a table showing the different medications that are commonly used and the risk of it. As you see at the top is the Depakote valproic acid at the highest risk. Next is the phenobarbital Topamax. And as we go lower, lamotrigine, levetiracetam, trileptal, and zonisamide, they're on the lower side. So women of childbearing age group better not be on Depakote, and work with the doctor, trying to get all the Depakote if you're on it before getting pregnant. So checklist when you are pregnant. So medication, as we talked, the medication levels may change. So you need to get the blood levels checked prior to getting pregnant, during pregnancy, on a monthly basis, and also after delivery. The hormonal levels change, the way our body breaks down the medications changes right after having the baby, so levels also change. So it's not just prior to getting pregnant or during pregnancy, but after having the baby, we have to check the levels too. Some medications change more than others, especially the lamotrigine. Lamotrigine, we tend to excrete most of it during the pregnancy. The levels tend to drop more so in the third trimester. I have had patients who ended up on a total dose of like 1,200 milligrams per day of lamotrigine because the levels were so low and they needed that medicine to be seizure free or to control their seizures. But they have to come off such a high dose right after having the baby. So it's very, very, very important to follow up with your doctor. And the low blood levels, it can trigger seizures. So what happens after having the baby? So again, follow up with the doctor closely. We have to check your levels and continue taking your medications. So what about breastfeeding? Can I breastfeed my baby if I have epilepsy and I'm taking seizure medications? Let's just look at the benefits of breastfeeding in general. In mothers, there's a reduced risk of having breast and ovarian cancer, less chance of having diabetes, less chance of having postpartum depression. Whereas in the baby, breastfed babies, there's a decreased risk of having respiratory infections, skin infections, asthma, ear infections, obesity, and even diabetes. So breastfeeding and epilepsy is encouraged. All seizure medications can go to the baby through breast milk, but the amount of the seizure medication that goes is very minimal. Actually, if someone is on one medication, like let's say Keppra during pregnancy, and they breastfeed the baby will be exposed to more of Keppra during the pregnancy when compared to the breastfeeding. And the risk from exposure to the medications is very minor. And the benefits of breastfeeding outweigh the risk. It is well known that breastfed children, they have higher IQ and higher verbal abilities at 3 years. So breastfeeding is encouraged. There are certain medications that you have to be cautious about, such as like benzodiazepines and phenobarbital, all those medications. They can cause some sedation in the baby. We may have to go down on the doses or get you off of those medications, but generally breastfeeding is encouraged in women with epilepsy. Parenting and epilepsy. There are some studies looking into it, how parents with epilepsy feel about being a parent. They found out that, okay, parents with epilepsy are deeply concerned about how their epilepsy is going to affect their children. They're always aware that a seizure may occur anytime. They're always worried about it. They try to foresee the possible danger situations and try to prevent them. And some of them are sad that they cannot take full responsibility for their child. So taking precautions and safety measures always help. To keep your baby safe, if you have seizures that come without a warning and suddenly, try to change your baby on the floor rather than on the changing table. Rather than giving a bath to your baby, just sponge your baby down on the changing mat on the floor. Carry your baby in a padded sling rather than your arms, and feed your baby in a shallow, like a lower height high chair, or when you sit on the floor. And how do we talk about my epilepsy with my kid? It's always once they are old enough to understand what's going on. It's better to talk to your child about your epilepsy. And some kids, like as young as 3 or 4 year olds, they can be taught to do some things when you have a seizure in front of them. You could teach them to stay with you so that they don't get lost, and you can teach them to get help from a neighbor or a friend, or calling 911. And it can also train them to help you themselves if they're old enough to do it. Moving on to epilepsy and menopause. So as we talked earlier, so around the menopause, like even 5 to 10 years before someone has menopause, the seizures may get worse. And almost like 2/3 of the women with epilepsy, they may see that, okay, their seizures are getting more frequent right around the menopause. And the reason for that is the changes in the estrogen and the progesterone levels. So estrogen level goes up right before menopause, and estrogen, as we know, can irritate the brain, can cause seizures at high levels, and that's the reason behind seizures worsening around menopause. But once the menopause happens, seizures tend to go down. So, but there is no role for hormone replacement therapy for after menopause, but because it is known to cause a lot of side effects and it can actually worsen the seizures. So to help the seizure control around menopause, the best way to do that is just controlling your seizure medications, changing the doses on it, and adjusting until the seizures are better controlled, rather than trying hormone replacement therapy. Let's talk briefly about epilepsy and mood. I think this is relevant and mostly during pregnancy also. So in general, psychiatric disorders are common in epilepsy. As you can see, depression can be seen in almost half of the people with epilepsy. Same thing with anxiety and panic disorders. Bipolar disorders and psychosis can also be seen, not as much as depression and anxiety, but they're very common. Depression in women with epilepsy is more common. It affects the quality of life, what we do, how our day goes, how we live our life. And just being a woman itself is a risk factor for depression and epilepsy. Almost 40 to 50% can have it. And it's more so often during pregnancy that many women with epilepsy experience mood swings more than women without epilepsy. It's very common in the first and the third trimester. And postpartum depression is real. It may be worse in women with epilepsy compared to women without epilepsy. It may happen even while you're pregnant, right before having the baby. It may happen as late as 8 weeks after having the baby. So if you have any mood changes or any changes in your energy levels or your motivation levels in the postpartum period, talk to doctor about it. There are things that we can do to help you with it. There are medications that can help. There is counseling, psychotherapy that can help. Meditation, relaxation techniques, all those will help. So be open about it if you do experience any mood changes during pregnancy or right after pregnancy that's affecting your life, affecting your quality of life, and affecting how you take care of your baby. Talk to your doctor about it. Be open about it. Moving on to epilepsy and bone health. So again, depends on seizure medications that you're taking. Certain seizure medications can cause bone thinning, and there's an increased risk of having fracture from it. So what are the risk factors, or what increases my risk of having bone thinning? Just being a woman itself, menopause, not exercising, having a sedentary lifestyle, smoking. If someone drinks too much alcohol, not being in the sun a lot, inadequate sun exposure because we need vitamin D, and certain endocrine conditions like your thyroid changes, all those can affect your bone health. And as we talked about earlier, like the sex hormones, the estrogen and progesterone, they not only maintain the reproductive organs, we need them for muscle mass, we need them for bone health. And after menopause, the amount, the estrogen and progesterone in our body tends to go down, and that can also contribute to bone thinning. Okay, so moving on to the medications which can cause bone thinning. These are the most commonly used seizure medications. As you look, benzodiazepine, carbamazepine, which is tegretol, gabapentin can do it. Trileptal, phenobarbital, dilantin, Depakote, zonisamide. Among all the medications in here, there's a good data saying that lamictal usually does not cause any problems with your bone health. Even Keppra and Topamax, they may cause some issues, but it's more so with the enzyme-inducing property, the same property that we talked about earlier. Those are the medicines that were developed in 1960s, 70s, like dilantin, Depakote. Phenobarbital is way older. It's been in the market since 1920s. All these medications can affect your bone health. So what do I do? Okay, if you're at risk for osteoporosis but don't have it yet, so monitor your calcium and vitamin D levels at least once or twice in a year. Bone density scan is recommended every 2 years. Taking supplementation, taking calcium at least 1,200 milligrams per day, and vitamin D at least 600 units per day is recommended. Exercises, especially resistance training and weight bearing exercises, are very helpful, especially with the bone health. If you're a smoker, stop smoking, cut down on excessive alcohol consumption, avoid too much caffeine. What if you already have osteopenia, or osteoporosis, which are basically bone health problems, bone thinning? You may have to go up on your vitamin D levels. You may need up to 2,000 units per day, and the level should be more than 30. Anything less than 30 is considered to be low vitamin D. So monitor your levels, make sure it's more than 30. Take all the precautions and measures to decrease the risk of falls and fracture. And if you're on medications that are high risk for worsening or making your osteoporosis worse, talk to your doctor, and consider changing seizure medications. And there are certain medications that can reverse or help with the bone thinning. You can talk to your doctor about that and go on those medications. If nothing works, seeing an endocrine specialist, endocrinologist, it would be the next step. So I'm going to summarize and give you the most important points from my talk today. So female hormones can impact epilepsy right from puberty to menopause. So some women can have more seizures with their periods. It's called catamenial epilepsy. Keeping track of your seizures can help you and your doctor trying to identify a pattern and coming up with a treatment option tailored to the type of seizures you have, if it's like right around your period, right around your bleeding, or mid-cycle, or in the second half of the cycle. So certain seizure medications can affect your birth control pills, especially lamotrigine and some enzyme-inducing seizure medications. So you may need a backup to avoid an unplanned pregnancy. And as I said earlier, the birth control pills can affect the level of seizure medications, and this is particularly true with lamotrigine. So consider intrauterine devices like a copper T or a Mirena if you if you need like contraception. They're both efficacious and they don't interact with any of the medications that you take. Take folic acid, at least 1 milligram every day. The folic acid and the multivitamin on the prenatals is not enough. So you may need to take an extra folic acid. And if you're actually trying to get pregnant, increase the folic acid to 4 milligrams every day. Talk to your doctor about your pregnancy plans. Being seizure-free at least 9 months to 1 year prior to getting pregnant increases the chance of being seizure-free during the pregnancy, and it is the best predictor we have out there. The benefits of staying on seizure medications outweighs the risk of harm to the baby. So don't stop your medications, don't lower the doses of medications, and work with your doctor to come off the high-risk medications and go on the medication with the lowest risk at the lowest possible dose. And the chance of a baby having problems is greater if someone is on more than 2 medications at high doses. Check in with your doctor. You may need blood levels checked prior to getting pregnant to get a baseline, during pregnancy, and also after pregnancy, because the levels tend to change. If we increase the doses of your medications during the pregnancy, you will not need the same doses once you have the baby. At such high doses, you may get toxic from such high doses. So we have to get you back on your pre-pregnancy dose very quickly. Breastfeeding is encouraged in all women with epilepsy. The benefits are way higher. The risk of exposure to the seizure medications is very minimal. Your baby would have been exposed to more medications when the baby is in the womb rather than compared to the breastfeeding. Always follow safety measures. There's increased risk of bone thinning in women with epilepsy on certain seizure medications. If you're postmenopausal, have epilepsy, on seizure medications, start taking calcium, vitamin D. You get a bone scan every 2 years or so. And if you do have bone thinning, you may have to increase your calcium, vitamin D supplementation. If you're a smoker, try quitting smoking and start exercising. All right, that is all I have for today.